Okay, ladies and gentlemen, welcome to another episode of Women's Health Today with Dr. C. I'm Dr. Leroy Campbell, also known as Dr. C, the Women's Health Doc. Today, we're going to be talking about a very important condition in women's health, and this is endometriosis. There are three questions that we're going to be looking to answer today. Three key questions we're going to be looking to answer in this video. The first question is, what is endometriosis? The second is, why is it important for us to talk about it? And then we're going to get into the third question, which deals with what are the causes, how it affects the body. And I think we'll achieve a lot if we're able to do that. All right. So, why is it important for us to talk about endometriosis? It's important for us to talk about endometriosis because this is a disorder that affects at least 10% of women of reproductive age. It is estimated that over 50% of women who are infertile or have difficulty conceiving will have this condition. Over 70% of women who suffer with chronic pelvic pain will have it. The unfortunate thing about this is that studies show that it takes between 4 to 11 years between the onset of the symptoms for many women to be diagnosed, meaning that women are suffering for as much as 11 years, more than a decade, with the debilitating symptoms of this disorder, simply because the diagnosis was not made. This is primarily because of a lack of knowledge. Women are suffering because of a lack of knowledge. And we're going to fix that today. The World Health Organization says that the general public and most frontline healthcare providers are not aware that distressing and life-altering pelvic pain is not normal, leading to a normalization and stigmatization of symptoms and significant diagnostic delays. Patients who could benefit from medical symptomatic management are not always provided with treatments due to limited awareness of endometriosis among primary healthcare providers. That's the WHO. So definitely, this is something we have to talk about, and we need to ensure that our women are educated about this very important condition. Apart from the fact that it's extremely common, we have to realize as well that endometriosis can have significant impacts on a woman's quality of life. When we talk about the fact that it's associated with significant and quite often debilitating pain, then it means that it may result in loss of time from work, loss of time from school. It may have impacts on a woman's ability to achieve her personal, academic, and professional objectives. Also, the other symptoms related to endometriosis, apart from just the fact that pain is going to affect functionality, some women also experience heavy bleeding, as well as pain during intercourse, which can also play a role in affecting relationships. Because if it is that intercourse is painful, then it's going to lead to quite often a reduced desire to engage in intercourse. And over time, intercourse becomes less pleasurable. And that can have significant impacts on relationships. I have had patients who, for them, the main issue was that their relationship was being affected by this because every time that they would engage in sex, this would now become something that is painful. And so they became increasingly apprehensive about engaging in sexual intercourse. So, of course, it's very important. We also have to understand that endometriosis is a chronic issue. It's not something that is going to be fixed at one point and it goes away. It's not like a urinary tract infection that can be treated with antibiotics and then the woman is fine. The symptoms are chronic. When we put all of these together, this is certainly a concern, a condition that we need to be paying attention to and ensuring that women, as well as healthcare providers, are appropriately educated and awareness is optimized so that we can have better outcomes for a woman. Let's talk a little bit about what endometriosis really is. It's really a condition in which the tissues that normally line the inside of the uterus, all right, so those tissues that normally are inside the womb here, actually, this is called endometrium, all right, so the endometrial lining, all right, these are the tissues that are shed every time a woman sees her period. This grows during the menstrual cycle and it sheds whenever the period comes. It is this tissue that comes out as bleeding. So, what a woman sees as her period is actually the shedding of the lining of the womb. For a woman who has regular cycles, this happens every month. Now, in the case of endometriosis, what happens is that these tissues that normally line inside of the uterus, for some reason, can find themselves in the other places. Most commonly, in and around the uterus. So you may have deposits on the ovaries, deposits along the side. So pretty much whenever you're having these tissues being found in other places. For example, here we can see the endometrial deposits on the ovaries on both sides, right? And what happens now is that these tissues, because they are similar to the tissues lining the inside of the womb, are sensitive to the hormones that control the menstrual cycle. Women who would normally have regular periods, each time a woman goes through her menstrual cycle, the same way the tissues on the inside of the uterus bleed, you have a similar thing occurring outside. The tissues on the inside that we looked at before begin to shed in response to the changes in the hormones. A similar thing happens with the tissues on the outside. You get bleeding. Now, the difference right, is that with the tissues on the inside of the womb, when there is bleeding, the blood comes out through the cervix and is expelled through the vagina. When you have endometriotic deposits in the pelvis, there is nowhere for that blood to go. While it eventually is absorbed by the body, when it is released, you have significant inflammation that's taking place in the pelvis because of the endometriosis. All right, inflammation. And one of the issues with inflammation is that inflammation leads to a number of things. So, firstly, inflammation, let's go a little bit further. All right, so this is a picture giving an idea of how the organs relate to each other on the inside. So the bladder is in front, the womb is behind with the vagina, and the rectum, where the stool comes out, is behind the vagina. And so when you have endometriosis, what's happening here is that you have these deposits in and around the uterus, on the ovaries. You have deposits scattered throughout the pelvis. You can have deposits on the bladder, on the rectum, even between the womb and the rectum. And as I said, each month, when the lining of the womb sheds, the same thing happens to these deposits within the pelvis. The tissue within the womb is able to come out through the vagina and is seen as a period, right? But what's happening inside, that blood remains trapped in the pelvis and causes inflammation. Eventually, it's absorbed. But until then, it causes inflammation and a marked inflammatory response that occurs because of the presence of these endometriotic deposits within the pelvis. Over time, a number of things occur. Firstly, inflammation leads to pain. Women who have endometriosis have inflammation, and that inflammation leads to pain. Women with endometriosis often experience painful periods. We spoke about the different causes of painful periods in another video, so if you have time, you can check that one out. Painful periods, what we call dysmenorrhea. Okay. Then women who have this inflammation over time takes on a certain pattern where the pain even starts before the periods, right? What we call congestive dysmenorrhea. Many times women with endometriosis may actually start having pain up to a week before their period starts. That's because of the inflammatory process that is taking place. Because generally, inflammation precedes the menses, but because this inflammation is occurring inside the pelvis, women are very sensitive to it, and it causes pain leading up to the periods. So that's one of the key things that quite often, when we take the history, when we ask questions, we can identify what's really going on and be able to differentiate between endometriosis and some other cause of pelvic pain. All right. Now, one of the things that happens here as well is that over time, chronic inflammation leads to scarring of the tissues on the inside. That scarring presents in different ways. One is that you can have what we call adhesions, or the tissues on the inside can become stuck together. So the ovary, for example, can become stuck to the uterus. The uterus can become stuck onto the rectum, and you get scar tissue inside. The problem with scarring is there are a number of things that can happen. Firstly, if there's a lot of scar tissue, that can also contribute to pain, especially during intercourse or even during an examination. Everything is connected. So whenever there's thrusting, there's stretching of the scar tissue between, for example, the rectum or the ovaries and so forth. So women will experience this. So this is another reason why women with endometriosis will experience pain, but also pain during intercourse, right? And we dealt with that in another video. So if you have time, you should check that out as the different causes of painful sexual intercourse. Now, apart from the effect in terms of pelvic pain and also the effect in terms of intercourse, chronic inflammation and scarring can also lead to tubal dysfunction. All right, let's explain that. So, tubal dysfunction meaning injury or damage to the patient's fallopian tubes. What is the fallopian tube now? So the fallopian tube, these are the tubes that transport the eggs from the ovary. So whenever a woman ovulates, the egg is produced here in the ovary, and the fallopian tube transports it from the ovary to the womb. And usually this allows the egg, if there's sperm within the genital tract, to meet, and fertilization or conception occurs. Now, in the case of endometriosis, then the scar tissue between the uterus and the ovaries and the tubes and the ovaries and the uterus can significantly distort the anatomy and affect tubal function. So one is scarring and also inflammation. So even in women who do not have much scarring on the inside, they may have difficulty getting pregnant because of the effect of chronic inflammation on the function of the fallopian tubes, as well as the fact that that inflammation may actually be toxic to the eggs and the sperm. Okay. So it's not surprising, therefore, that the evidence shows that over 50% of women who have infertility will also have endometriosis. All right. So what are we saying then is that endometriosis causes chronic inflammation, which leads to pain, which leads to scarring, and that can not only affect the woman's quality of life because of the pain, but may also affect fertility. Now, let's talk a little bit more about the pain with endometriosis. It's very important for us to recognize that the body is comprised of interdependent systems. In other words, if there's a problem in one area of the body, it can lead to problems in other areas. That's a general rule. So, if someone, for example, had an ankle injury and it affected how they walk, then over time they may find that they may be having pain in the knee or pain in the back because of the fact that the whole function of their body has been thrown off. Okay? Now, it's a similar thing happens in the case of endometriosis, because in the case of endometriosis, the chronic inflammation leads to changes in the mechanisms of how the body functions. When someone is having significant pain, they tend to be more tense. It affects how they breathe. It affects how they walk. And that underlying tension can cause spasm of the pelvic floor muscles, which then in turn leads to spasm of the lumbar muscles or muscles within the back. And so it's not unusual to find that women with endometriosis may also have back pain. They may also have issues in terms of the pelvic floor dysfunction, which also contributes to discomfort during intercourse, etc. Now, all this is going to be important when we talk a little bit about treatment, because it causes us to realize that sometimes, even when we treat the endometriosis itself successfully, there may still be symptoms if we're not aware of this truth. And so it means that the multidisciplinary approach to managing involving the physiotherapist, for example, may be beneficial to deal with the muscular spasm and all the other factors that now cause pain. And that's something that we're going to get into when we talk a little bit more about the treatment of endometriosis. Okay, so I think we have achieved a lot in this particular video. We have defined endometriosis. We have spoken about why it's important for us to be aware of. We have gone a little bit into the disease itself and how it manifests its effects. All right, so that's it for me for this particular video. And once again, if you're new to the channel, understand that what we're doing here is really focused towards empowering women through quality health education. And so if this is also important to you, be sure to make sure that you hit that like button, make sure that you share this video and subscribe for more content so that we can continue to help women live happier, healthier, more fulfilling lives. All right, so I'm Dr. C, the Women's Health Doc. Until next time, take care.